In this episode of Muted in Medicine, we explore the discomfort of medical uncertainty, how it impacts decision-making, and the emotional toll it takes on healthcare providers.
So it's a consciousness or awareness that that there's an unknown. I actually realized that so much of medicine was actually these kind of non-textbook skills.
How, I would say, does it affect the clinician when there is uncertainty?
If you have a low tolerance, it might lead to stress, to avoidance, like not wanting to get the answer, or kind of overdoing things or overthinking, like never settling down to never putting your nickel down. On the other hand, if you have a really high tolerance, you might be a little bit cavalier. You're like, oh yeah, like it's fine. We don't have to send that. We don't have to consider this other difference.
Yeah.
This sounds like this thing is good enough. I think a lot of physicians also are worried about expressing and communicating, or let's say disclosing the uncertainty to their patient. I often ask patients, what are you most worried about?
Yeah.
Or what are you most concerned about? It's not like black and white, good or bad, to talk to patients about uncertainty.
How are we dealing with uncertainty to our students, residents?
It can actually impact the care that the physician provides. So specifically when, again, looking at trainees, it can impair their ability to be more transparent about communicating, for example, the concern, because there may be a worry that the expression of uncertainty may suggest an expression of incompetence, which again is not true. Here's what I'm uncertain, but here's the action I'm going to take. That's the opportunity to build confidence. So for anyone listening out there, if you're uncertain, good for you. It's important, good for you that you have that first step, which is recognition of the awareness. Good for you that you're listening to this, or you're speaking to a mentor or a colleague, because you're making it possible for them to say the same. And thank you for this podcast, because, we don't talk about it enough, but we all experience it.
Somewhere ages and ages hence, two roads diverged in a wood, and I took the one less traveled by.